Dr. Heft is going to be our slide driver today, but we're going to alternate a little bit across speakers. Dr. Heft is an assistant professor in Division of Oral Epidemiology at UCSF and does a lot of community-based and public health research. Like a lot of other people, I think she does do work in both oral health and the area of tobacco and vaping, particularly for teens. I know a lot of us are seeing that increase in our communities. And we've all been really excited to be able to work with her and her background with patient-provider communication. I think a lot of the elements of the toolkit are things that cross these types of elements that you've described around, you know, equity, access, as well as understanding how health literacy and oral health literacy are really some of the really key social determinants that can drive people's understanding of health information. So welcome to Dr. Heft, and you're going to start us off, right?
Yes. Here are our names, and we know conflicts of interest. Are you going over the objectives?
Sure. So today we're going to do understanding oral health literacy, basic principles, give you a little bit about the background and development process for the oral health literacy toolkit, and then talk a little bit about best practices for basic health literacy and oral health literacy, and unpack the toolkit a little bit for you.
I think Becca is going to go over some of the health literacy background.
Right. So the reasons that, here are some of the reasons that oral health literacy is important. First, more than 2/3 of US adults lack understanding of health information. So more than a majority. Many people understand only the most basic health information. And literacy, that is general literacy, tracks with health status more closely than age, income, employment, education, or racial or ethnic group. So it's really important. Next slide. So people who do not have good oral health literacy go to the dentist less often, and they have more severe caries. Can we go back?
Yeah.
Thanks. And people who understand the information that they receive in a healthcare setting are more likely to follow their care instructions. And if they don't feel embarrassed, ashamed, or afraid in a healthcare setting, they are more likely to come back and get the care that they need. Okay, and people who are health literate, this is a definition that we use at HRA. It's a 3-part definition, and it's also used by the Department of Health and Human Services, and it originated with the Calgary Charter, which was published in 2011, although the development of it started in 2008. But people who are health literate can find, understand, evaluate, and use health information. Let's go on. And part 2 of this new definition of health literacy is about healthcare professionals. Healthcare providers, including oral healthcare providers, can and should also be health literate. They can do this by helping patients acquire, understand, and use health information. This effort has more layers to it than you'd think at first, but it's really what our oral health literacy toolkit is all about. And part 3 of the definition involves healthcare organizations such as dental practices or LOHPs. Organizations can be health literate by providing equal and shame-free access to and delivery of oral health care and oral health information. Again, there's a lot to this, and it's addressed in the oral health literacy toolkit. Okay, this is a short exercise that is designed to demonstrate what it's like to struggle with health information. Let's take a minute or two to read through this paragraph and see if you can fill in the blanks and figure out what this paragraph is talking about. So maybe a minute to look at this. Is that enough time for people? Should we move on? Anyone have any guesses? Knitting is close and can eat. Okay, let's move along to the next slide. It's definitely, you're on the right track. So this is actually a handbook for using a serger, which is a specialized kind of sewing machine that works on knits. So yeah, there's, these words that are missing aren't super unusual words, but in the context, they're pretty hard to figure out. And if you're not, someone who sews, and if you haven't had experience with a serger, this is probably at least a little bit confusing. So, the idea here was just to give you sort of the feeling of, I do not know what this is about. And this is the experience that people have with health information fairly often.
All right, so knowing that oral health literacy is so important and something that affects many, many people, we had the aim of helping California dental providers and organizations to become more health literate. So we did some preliminary research to find out what needs and strengths around health literacy already exist. And one of the first things we did was a needs assessment with the LOHPs, the local oral health programs. And we conducted a survey with the local oral health program directors last year. And I'm just going to share a few bits of information from that with you. So we had the directors rate the current oral health literacy knowledge of them and their staff. And you can see about half felt that them and their staff had good knowledge of oral health literacy. A few felt very good, but we also had fair or poor. And so there's still some need to work on this topic. And we also had them write in what they felt the definition of oral health literacy was. And only 12.5% of them knew the complete definition of oral health literacy, that 3-component definition that Becca gave you earlier. A lot of people had maybe one piece or a partial understanding. And since we think it's really important for the health literacy to be not just within the individual patient or community member, but also in the provider and the organization, this really helps us understand the need to increase that knowledge. And we also asked LOHPs for what kind of training format they would like to learn about these things. And they asked for additional training about oral health literacy so that they can use the latest and best approach, help their community reach people more effectively, improve health disparities, and improve their own communication skills to better serve their communities. So they're really motivated to help their group and do it in the best way possible. We also conducted the California Oral Health Literacy Study. And for this, we were looking at dental providers. So we spoke with dental practices with over 50 dental providers, including assistants, hygienists, and dentists. And we were, so we carried out a study to assess the current knowledge of oral health literacy knowledge, guidelines for practice, and resources for dental providers in California, with the goal of identifying the most effective approaches for dental and medical teams, examine gaps in literature and practice guidance, and assess patient materials in order to inform the development of trainings and resources statewide to improve dental teams' communication with patients about oral health across California using best practices for oral health literacy. So as we did this, we identified 3 main gaps. The first was that there was no existing systematic review of scientific literature about studies of the extent to which dental team providers' communication with patients and caregivers meets oral health literacy recommendations. The second gap was that there was no formal assessment of oral health literacy training materials or toolkits. And the third gap was to adapt oral health literacy training to specific groups of dental team providers. And so this slide sort of is a schematic of all the steps we took to address those issues. So we conducted a literature review of all the current evidence. We conducted key informant interviews with the 50 providers. And then we also did a scan of guidelines, trainings, and education materials to see what is out there and what is its quality. And those 3 pieces together led us to an understanding of oral health literacy in California. And we used this to develop the toolkit and trainings like this one for oral health literacy for people across California. And so that's the findings of that is what we're presenting today. So the key findings of that were that the providers, the assistants, hygienists, and dentists, they reported low use of recommended communication strategies, things like teach back and motivational interviewing. And when we reviewed the oral health literacy materials, they were in need of improvements, or the oral health education materials were in need of improvements. So based on all those study results, the recommendations from Health Research for Action, or HRA, were to create a toolkit of digital training materials on oral health literacy for oral healthcare providers, and also develop plain language educational materials for community members.
Okay, so this is where you and your colleagues come in, improving health literacy. You can play an important role in both improving the oral health literacy of the people you work with, as well as evangelizing this issue among the healthcare providers in your professional sphere. So next, we're going to walk through some of the techniques involved. Still not ready yet, Kristen.
Sorry.
Can you go back? Yeah.
Yes.
So some of the techniques involved in making healthcare communications understandable and usable for the widest possible audience. Okay, now let's go on. Okay, so first let's get away from the myth that communicating in health literate ways only benefits certain populations. It actually helps everyone because we all have moments of stress and confusion, and none of us is an expert in everything. And even someone who doesn't have any difficulty understanding a piece of information still benefits from clear, action-oriented information that can be absorbed easily. So treating everyone as if they have limited health literacy skills helps reduce communication errors, and it ensures that the needs of all community members are met. We refer to this as the universal precautions approach. And when you take the universal precautions approach, you reduce bias in how you treat patients. And of course, that's what we all want to do, is treat everyone equally well. Okay, let's go on. Okay, a really good way to start with health literacy and to get an idea about how you can change your communications for the better is to put yourself in your audience's shoes. So imagine that you are the person who's reading a new patient intake form, for example, and look for words or questions on the form that might be hard to understand, hard to answer, or just uncomfortable to answer. And we want to apply that empathy process to every communication or interaction that a patient has. So this slide is basically lists some of the questions that you ask yourself when you're trying to put yourself in the patient's shoes. Okay, so best practices for oral communication are using simple language, explain medical and technical terms or jargon when you have to use them. Don't overwhelm people with by throwing too many ideas at them at once. We know people only retain part of the information they hear, and we know that stress, pain, and fear really limit how much information people can take in. If you're asking people to adopt particular behaviors, don't ask for too much. Give people a few things to do or change and build on that later. And also use techniques like teach back and motivational interviewing, which involve your patient. Teach back is a way to verify that a message has been received accurately, and you do it by asking someone to say back to you what you just said in their own words. Motivational interviewing is a dialogue between a healthcare provider and a patient in which providers support a patient's desire to make a positive change, and patients are active participants. Best practices for written communication are using plain language. Try to write at a 5th to 8th grade level and use short sentences. Break text into short chunks. We like the general rule of thumb to keep sentences to a single idea and paragraphs to a single topic. Make the material focused on key behaviors and filter out any information that doesn't directly relate to those. For example, background information that's nice to know but not need to know. Short sentences, generally for us, that means keeping them to between 10 and 15 words. Okay, let's go on. Okay. Sometimes you will receive patient materials that you didn't create, and you need to decide whether they're going to be suitable for your audience or not, or if it's health literate or not. We do this kind of assessment at HRA all the time. It can be challenging to find something that's rarely is one patient material, one size fits all. People are different, so sometimes you need to customize your material for them. Gauging the health literacy of material isn't as simple as running a test to find the grade level of the writing. Some people like to say, oh, I'll push a button and I'll figure out whether this is good material or not. And that's there's a lot more that goes into it than just those grade level scores. With practice, you can learn how to do these kinds of assessments. There are tools to help you, and they're methodical, and there's help available. It's definitely a learnable thing. One of these materials in particular is good for beginners, and we recommend starting with that. And that is the Clear Communication Index, which was created by the CDC. And it's a good introduction to assessing patient materials. The scoring system is step-by-step. It was research tested and it's recognized by experts. So you can pretty much count on it being a reputable tool, and the score that you come up with, you can count on. You can download it from cdc.gov/CC index. And the CCI gauges the quality of materials in 7 main areas. What's the main message and call to action? Basically, can you figure out what those are? Is that clear? Is the language simple? Is the information design clear? And by information design, we're talking about the size of the type used, are the graphics relevant and understandable? Is there enough white space? So the design elements is what we talk about with information design. State of the science. This is a little bit unusual for health literacy assessments. I don't know of another one than the CI that asks whether the material reflects current scholarship on the topic at hand, but it does ask about that. Asks about what behavioral recommendations the material makes, asks about how numbers are used in the material, which is an important component of health literacy. We refer to that as numeracy. And what we know is that people are even worse at dealing with numbers than they are at dealing with words. So clear use of numbers is an important component. Finally, it talks about how does this material communicate about risk is another important component of whether a material is health literate or not. And we can, those are really big issues, but the CCI gives you a way to at least start to think about them. Okay, so let's take a look at the tools that are in the Oral Health Literacy Toolkit so you can get an idea of how they might be useful in your work and for the oral health care providers and people you work with.
So we'll be providing the links so you can all access the Oral Health Literacy Toolkit towards the end of the presentation, but we wanted to walk through and showcase some of the things that are in there so you know what to expect and how to use them. So the materials are designed to help providers learn the basic oral health literacy principles, some of the things we've covered today, including communicating clearly, covers teach back and motivational interviewing, and with cultural humility, to create shame-free and fear-free environment, understand how oral health literacy affects patients, and the need to arrange language services. All right, so some of the things that are in there are the Oral Health Literacy Guidebook. It directs providers. And it kind of just walks through some of the things we covered today, but all the things you would need to know in order to have successful communication with patients or community members. So it helps you connect better with patients and understand their needs, implement health literacy at every single touch point of the patient visit. I like how it really breaks down. It helps you think beyond just the patient interaction that would be considered a typical dental visit, everything from finding the dental clinic to scheduling an appointment to thinking about what happens after a visit. It walks through all of those things. And it also provides guidance on how to make changes to improve on these different skills at your own pace. Since you guys are a community-based group today, I think that a lot of the things in this guidebook are also relevant to any kind of work where you're interacting with people of any people. And so a lot of these skills, maybe you're not helping people schedule dental visits, but a lot of the tips and practices are good for any kind of interactions or trying to work with people. So I think there's things in there for everybody. One of the things that is in there is a practice assessment. It's a checklist that kind of goes over some of those things that might be considered in the organizational health literacy definition that Becca went over earlier. It helps you think about all of the different aspects of being a health literate organization and identifying sort of where you are on that spectrum. If you're doing well, if there's some areas where you can improve on. I think it's a very thorough list that brings some things to attention that you may not originally think about. And it helps providers quickly learn what they should improve in order to communicate with all patients better and reduce fear and shame. One of the cornerstones of this guidebook is teach back. So as Becca said, using the teach back method is when you confirm that patients understand what you've told them by asking them to explain back to you what you just told them in their own words. And this has a lot of different tips. It walks through step by step how to do it. And then it also has some sample questions that you can ask, different ways that you can word it so that you're asking people to explain back to you what you just said in a way that seems natural. And it also has some scenarios that you could use as practice to work on your skills, which I did the other day with a bunch of dental students. And it was really great to see that it takes a little thought to be able to hear. So you ask someone to explain back what you just taught them, and then you have to listen to what they say and say, okay, confirm what part that they got right, and then maybe re-explain something if they didn't explain it back fully. And so that second step, I think, is one of the important skills. The guidebook also has an action plan. And this is to help providers come up with their own goals and their action steps to actually make the change that they recognize through the earlier checklist step. I think Becca's going over this patient resource.
Yep. Hi again. Yeah, so the patient resource is a brochure for patients called Going to the Dentist, and it's available to download and print out. And it explains the before, during, and after. I'm very sorry. Of course, this happens. I get on and my dogs go nuts. So please ignore the barking in the background. So the purpose of the brochure is to really explain everything that relates to a dental visit, so that people know what to expect and how to prepare. And really, this is oriented toward people who have never had formal oral health care in our country before. So, people who are new to the US, this might be helpful for. Okay, so let's go on to the next slide. And so our first effort at making this available to, to other communities who might be new to formal oral health care is that we are translating the brochure into Spanish. So it's all of the same content as in the English brochure. We should be finished with it by the end of the year. Right now we are in user testing with the Spanish brochure. We're asking Spanish speakers to review it and tell us whether there are parts of it that are hard to understand or don't resonate with them. So when we get finished with that, we will finalize the brochure and make it available with the rest of the toolkit components on the COHTAC site.
All right, so as I mentioned, I think a lot of the materials in the toolkit itself can be used directly by you guys in all the different community outreach work that you do. It's really, the majority of it is really just best communication practices about any topic. And so I think those materials will be helpful for you in your regular work, but we also want to bring the toolkit to dental providers to try and improve communication between dental providers and patients that they serve. And so some of the ways that, so we're looking for help from the LOHPs and the groups that they work with to help support the toolkit initiative and help spread the word and bring awareness and endorsement to dental offices in their area. So some of the ways that you can help us increase awareness and adoption of the toolkit are to ask dental offices as you're out and interacting with them, do you know about the oral health literacy toolkit? Do you have an oral health literacy champion? Have you assessed your practice for oral health literacy? And then you can also explain oral health literacy. So and endorse the importance of oral health literacy that increases patient loyalty. It decreases miscommunication. It can be implemented on the practice's timeline. And emphasize that the toolkit allows practices to assess their own oral health literacy readiness, improve provider-patient communication, improve safety. And you can also recommend them to other resources that they can use, including the COHTAC website, which I'll go over in a little bit. But we're just asking your help as you're out working with other organizations or dental offices to just help spread the word so that we can increase its adoption and get more providers using TeachBack and improving the experience for their patients. All right, so in order to access the toolkit, it is available at this website, which I'm going to put in the chat as soon as I stop sharing slides. It's at oralhealthsupport.ucsf.edu/oral health literacy toolkit. And this is where all of the materials that we just went over, the guidebook, the brochure, the TeachBack checklist poster, all of those materials are there. They're free to download. You can print them from there. And when we have the Spanish language brochure, it will be added there as well. And also on that website, oralhealthsupport.ucsf.edu is the California Oral Health Technical Assistance Center, or COHTAC. I'm not sure if you guys are familiar with this group, but this website has a lot of different resources. So if you have not been and you're ever looking for anything related to oral health, I highly recommend that you check it out. This link here is the resource center, and you can see we have a really wide menu of many different oral health topics, including water fluoridation, rethink your drink, school and screening programs, tobacco and vaping cessation. All of these are materials that have been vetted by experts and are high quality. And you can also search here to browse for something that you might be looking for. If you're looking for something in for a particular age group or a particular topic, this will help you narrow it down. And there's a lot of other things on that COHTAC website, so I recommend that you take a look. And then finally, here's our contact information. Feel free to reach out to us if you have any questions, and we'll make sure to share the slides with Adeline to send out to you guys as well, so you'll have them as a resource going forward. Thank you for sharing your time with us, and we're very happy to take questions on all the topics that we covered. If you have any, I'll put the links in the chat for the toolkit right
And thanks, Kristen and Becca. Sorry, I didn't get my introduction in for Becca, but I think everybody introduced themselves. I don't know if anyone new joined us that wants to introduce themselves too, but definitely we're happy to take any questions, and we will put a link in the chat and also send it to Adeline to get feedback from you about the presentation, things that you would want to see included or things that you don't want to be included. We're always looking to improve the presentations and make it most relevant for LOHPs, as well as these other types of programs like you have here at the table, tobacco programs, and other folks who are out in the community and see community needs and can let us build on what we've put together here.
This is Vince. No, I appreciate that. I think it's very well done. I appreciated that you put in the beginning the historical background, that you actually went out